My name is Edtrina Moss, a doctoral nursing science student and the Graduate Nursing Student Academy Liaison for Texas Women's University in Houston, Texas. The GNSA has launched the Liaison Leadership Project, Great Minds in Nursing, Insights from Nursing Thought Leaders. We're here today to talk to one of TWU's nursing thought leaders, Dr. Sandra K. Cesario.
Thank you.
Hello and welcome, Dr. Cesario, and thank you for taking out time from your schedule to have this discussion with us today. So, Dr. Cesario, tell us a little bit about your title and role here at TWU.
Sure. I'm currently the doctoral programs coordinator. I've been the PhD program coordinator for about the last 7 or 8 years, but just recently this year I've also assumed the oversight of the Doctor of Nursing Practice program as well, which is a couple of years old as far as TWU is concerned, but it's new to this campus. So I'm the coordinator of both of those programs here in Houston.
Great. So give us a little bit of description about your nursing work and tell us a little bit about your career.
Oh my, that's been a very long time. My career trajectory, I think, has been fairly broad and winding. Some people have very focused, targeted careers, but I think mine is a little bit more broad. It's always focused on the health of women and newborns in general, but from a somewhat broad perspective, I think I've had very many roles to get to the point where I am today. I think I have a very strong clinical background. I went to a diploma program originally, and that provided me with good bedside skills, I feel. But I've also had a number of other roles besides bedside nurse, manager, educator, researcher. So my roles have been very broad, and so is my experience with different populations and different geographic areas. I've lived in 7 different states, and pretty much in the middle of the United States, but I've been associated with institutions that are very urban and very rural, public and private, serving a variety of different populations. So I think that broad experience has given me the big picture of what women's health is all about in the United States.
So, how did you get into your current position?
I think I enjoyed teaching even in a clinical setting, and I've been an educator now for between 25 years or so, primarily just at the University of Oklahoma and here at Texas Women's University. They're both fairly large universities with large nursing programs on multiple campuses. I enjoy it. I like the diversity. I like teaching all levels. I have taught from the undergraduate level all the way through to doctoral students. So each level has its own challenges and interests, but I really I've settled down more in the doctoral education. I like the research. I like being a part of the scholarship part of nursing and what we can do as professionals with advanced degrees.
Great. So that leads us into the next question. How would you describe your leadership in the nursing and healthcare field?
I think I've had a lot of opportunities for leadership and in different capacities. I went through my CV to try to identify where some of those places were. I was first licensed to practice in 1976, and I said it was that bedside clinical hospital type nurse for a number of years. That gave me a good solid foundation in patient care and that setting. It was really in the early 1990s. It was my first, what I feel is a real true leadership opportunity, and that was I was hired to be the coordinator for the OB nurse residency program for the U.S. Public Health Service, Indian Health Service. It was a nationwide program where people come from all over the country, literally, to learn OB care, maternal newborn care, places where they have nurses are responsible in rural areas, in Alaska, in Montana, New Mexico, they're responsible for taking care of women and newborns at a high level, but they don't have the volume in their facilities. So they would come to me in Oklahoma, where we had a fairly high volume OB population, provided them with didactic instruction, clinical instruction, and experience. And I feel that was my first real opportunity to impact healthcare nationwide, because we had participants in that residency from all over the country. In the mid-90s is when I started my doctoral education, which added the research component, which opened a number of doors for other opportunities. And with my clinical experience, my teaching experience, I think I got involved in professional organizations at a national level that had that potential to impact practice. A1, the Association for Women's Health, Obstetrics, and Neonatal Nurses, is the standard bearer for the United States as far as care for women and newborns. And I was a chair for a number of task forces within that organization. Two of the updates of the standards for professional practice for women and newborns in 2003 and 2008. I was a project manager for many evidence-based practice guidelines. The first one I was involved with was the team leader for the second stage labor management guideline, but I've also been involved with many of the other guideline developments: neonatal skin care, diabetes care, regional anesthesia. Some real important guidelines that drive practice within that specialty area in our country, and then also some other leadership positions in Sigma Theta Tau and American Nurses Association. But I think in my clinical area and advancing research, using research in the evidence-based practice guidelines, I can't emphasize how important being active in your professional organizations, that's just a key piece of disseminating research to impact practice, to inform policy. So I encourage nurses to really get involved in their professional organizations in whatever clinical specialty they're involved with.
You touched a little bit about how your interest in women's health and neonatology addresses nursing and healthcare, and a little bit about the gaps in the science and the research. Can you talk a little bit more about the significance and the impact on state and national policy?
Oh, I think it's huge. I think it's absolutely huge, because my specific interests with women and newborns, some of my more narrow-focused projects, both research, teaching, and policy development, has to do with violence against women, newborn abandonment, some global women's health issues, and women's cancers, particularly ovarian cancer. And the scope is huge, because over half, about 51% of the population in the United States is female. So, that's half the population. But the statistics, I think, are really astounding when you look at violence against women. In our country, 1 in 4 women will be affected by violence in some way. And those numbers are even higher in other countries. So it's a huge issue. It has potential for that intergenerational, if you've been involved in a violent situation as a child, boys that witness violence are more likely to be abusers. Women are caught up in the poverty cycle. So it's a huge intergenerational problem that needs to be addressed. As far as other things related to women, the maternal mortality and morbidity in our country, we rank about 40th in the country. We spend the most money on some of those women's health issues than any other country, and yet we are ranked 40th when we look at some of those statistics, which is certainly an area that needs some work to address. And And then the women's cancers, as I mentioned, ovarian cancer is something I'm concerned with because of a personal experience. However, ovarian cancer doesn't affect as many people, but it is the most lethal cancer that's unique to women. So it is something that we need more research dollars, better screening, all kinds of can be done in that area. So I think any of those women's health issues that have been involved in different areas are important because the health of women impacts the health of families, communities, and ultimately our nation. So it's bigger than solving the problem in one tiny disease. It's the big picture of how the health of women is so important.
What do you think will be better in nursing and healthcare because of your science and leadership?
I'm hoping the health of women in general. I think some of the work I've done research-wise or work within professional organizations will help inform policymakers, the community. It's bigger than just educating nurses, which I think is a piece of what I do and a very important piece, but it's bigger than that. We need the interdisciplinary, we need to inform the people making policy, and I think that's an important role for nurses.
How do you expect to inform or translate your research into healthcare policy?
Well, I have had some experiences doing that, very rewarding experiences. When I first moved to Texas in 1999, it was right at a time when newborn abandonment was a big problem here. There were 13 abandonments in about 9 months, and some of those babies did not survive. And Sheila Jackson Lee headed up a task force to look at that problem, and I was honored to be a part of that task force. And as a result, Texas was the first state to pass safe haven legislation and was a leader for the rest of the states, and almost every other state now does have some legislation related to safe haven issues when there's an unwanted pregnancy and gives women options so that that baby can survive and the woman can not be legally liable if she follows those the rules from each state. It provides her a safe way out. But there are some other things I've done too as far as related to ovarian cancer. I'm a member, active participant with the Ovarian Cancer National Alliance. They meet in Washington, D.C., and our main activity is walking over to the Capitol and knocking on doors and informing our state representatives and senators about ovarian cancer, about why it's important that we need more research dollars. And it's fun seeing them understand the issue, not just saying we need more money, but why and how that impacts women in our country and how they can help with that. And one other thing that I think I help shape policy is I'm a member of the steering committee for Texas One Voice, a subcommittee of that called the Women's Health Initiative, or WIT, W-H-I-T. And we look at women's health services, things, access to care in general, might be reproductive health, but it's bigger than that. Opportunities for women in the state of Texas, our Maternal Mortality and Morbidity Committee. Texas was one of the few states that it did not have an official formal committee looking at that problem within our state. And we're a big state, so that has just happened. This year, the governor did appoint a task force to look at that, and with some funding, with nursing representation, and it's such a success story. I'm really excited to see that Texas is finally getting on board, looking at maternal mortality and morbidity in this state.
You're really busy.
It's fun though. It's fun.
How does your science impact healthcare systems? What are your thoughts about that?
I think some of the things I just mentioned, like the Texas One Voice, the Women's Health Initiative, it is an advocacy group that looks at systems within the state of Texas. How do we deliver care to women? How do we make sure women are accessing the services that they need? I think in some of the political arena, it gets caught up in abortion and birth control, but it's much, much bigger than that. Just access to general services for screening for cervical cancer or mammograms or chronic health issues that affect women disproportionately. Do our women in this state have access to those services? So participating in those groups and being active, not afraid to speak up as a professional nurse with a voice, independent of medicine or other healthcare providers. We're nurses, we have our own body of science, and I think we have a lot to offer.
Great. Is there any other information you would like to provide regarding your program of research and scholarship?
I think as far as the scholarship and scholarship degrees, I encourage recent graduates, you're holding a PhD, you have all this education, use it. So often you see such potential and great research being done, and then people get caught up in other work lives, family lives. I think if we're going to move forward as an autonomous profession, we need to really encourage nurses to continue their education, to move forward, to use that knowledge and skill about informing policy, about using statistics and research and that evidence to support what we're saying, what we need, and what we want.
What advice do you have for the next generation of nursing leaders?
Well, it really is an exciting time to be a nurse. We have gradually over time increased our autonomy. We are an independent entity in healthcare. We're moving forward with advanced practice roles. And not only in the healthcare setting, in the community, and representing the bigger picture of healthcare, I think nursing in general could do a better job of presenting a united front on issues. So nursing is very large and different levels of education, different types of practice. Sometimes we have competing ideas on how things should be. And I think if we could present a unified front on some of these issues, we would have the political strength to really change or inform practice. So I really think we could do a little bit better job with that. And can just keep going to school. It's encouraged for nurses to advance their education. I think that's important if we're going to sit at the table with physicians and other healthcare leaders, to be knowledgeable, to be well prepared, and we will get left behind if we don't. The science that informs healthcare is moving ahead so rapidly. If you don't stay up to date, either through education or activities, continuing education, whatever that is, you're going to get left behind. So I encourage people to do that lifelong learning thing that's so important.
Well, then, how exactly would you encourage the bedside nurses to become more involved in evidence-based practice and nursing research?
I think what's very important is to have those individuals really buy into it and own it. The bedside nurse is the most reliable source of where are the gaps in practice, where is there variation in practice, what is the best practice, what works well, what doesn't work well. How do we know taking vital signs every 15 minutes is better than taking vital signs every 20 minutes? I mean, there's so many things we do just because that's how it's ordered, that's what we've done, but where's the science that supports what we do? And from working with A1 and developing the evidence-based practice guidelines, it is that bedside nurse that can identify those areas of practice. And then keeping them involved in the project. That identify where's the gap or the problem that needs to be investigated, then ask them, what do you think you should do about it? What should we look at? Let's look together at what the literature says. Let's design a study together, and keeping them part of the process, really fostering that concept of nursing research, not the nurse as a data collector for another, for a doctoral student or for a doctor, MD. I think it's a body of nursing science that involves all of us, and we need to keep people involved in that. And I think what would help that or foster that would be to have the institution make that a very visible mission or part of their mission statement, that they buy into this bedside nurse as a researcher to inform the body of nursing knowledge. So it attracts bedside nurses that are on that same wavelength as far as this is a facility that supports nursing research. I will have a say in how to change practice for the best outcomes for our patients. I can be a part of this. My agency that I work for will support me, if that's time, if that's money, if whatever that is, that it's a part of the culture at the institution, not individuals trying to do little things here and there. That it's interwoven into the overall culture of the agency.
Well, thank you so much, Dr. Cesario, for taking this time, and thank you so much for your contribution to nursing and to GNSA.
Well, thank you.
And to the great minds of nursing.
Thank you so much.
Thank you.